What have I been doing besides continued exercise and eating whole foods and staying away from all the poisons? Well, been dealing with a little seasonal depression. If you haven't noticed, it's what it looks like usually. See the grayness? Yeah, the wind. Wonderful, wonderful stuff. Yeah, okay. Whew. We got a nice warm coat. We got nice warm boots and a nice warm hat and a nice warm house. But, you know, it's good to get fresh air, I suppose. My blood work's been normal, with the exception of some low phosphorus. Not real low, like I think the minimum's like 2.2 or 2.1 and I'm like 2.0. So my phosphorus and my calcium is just a tad bit below the line. Other than that, a few nights ago I got up to use the restroom, and halfway in between I blacked out and hit the floor. And doctors seem to think that it was due to dehydration, which makes a lot of sense, because I have been getting like dry hands, dry lips, dry feet, and mostly from like being outside, because I have humidifiers in the house. But I wasn't really paying attention. It was probably over the course of a couple weeks over the holidays where I just wasn't paying a lot of attention to you know, to how dehydrated I was getting. But it's really dry, really cold and really dry outside, so I've been out here working, piling wood, and I just got overexerted and dehydrated, and it all caught up with me. My wife, we suspect, had that Omicron starting on Christmas Day, and then both my kids started having symptoms New Year's Day. So, of course, in good fashion, I took care of them all, because that's what you need when you're sick, is a cancer patient with leukemia to take care of you. Because apparently I can't get sick, or at least I don't get sick like they get sick. I don't know if it has anything to do with my medications or just my overall healthy lifestyle, but that might have led to some of the dehydration problems. Just having and fighting stuff that I didn't know I had. No snot, no sneezing, no coughing, none of that. Not like the rest of them. So we're just out here banging away. So for all of you who exercise, and make sure you hydrate. I found that Pedialyte got me back pretty fast. Here's my wood pile. You can see that. Yeah, I didn't chop the wood, but I did stack the wood. So, you know, I think it's about 6 or 8 cord. Anyways, yeah, make sure you stay hydrated. And Pedialyte Free and Clear doesn't seem to have really any chemicals. Got a little zinc in there. Seems to be the best. I did buy this stuff called Light Show, but again, it wasn't available in my local store, so it hasn't arrived yet, but it's coming from Amazon. And you know, it's getting harder to exercise and do the things that you want to do. Like, see my basketball hoop? Yeah, that's one of the highlights of spring and summer right there. Not available right now. So anyways, that's my update. I'm gonna go get some more lab works tomorrow, just to check and see how my white and red blood cells and all that good stuff is. And other than that, just diet and exercise, and for mental health, positive thinking, and trying to boost the serotonin as much as possible. Easy to do with eggs and cheese, apparently. That's what I eat in the afternoons. Like, again, you know, doctor didn't say I couldn't drink, but I just decided that it's probably not a good idea, right? So I have nothing to boost my serotonin as far as poisons go, so I must rely on food. Otherwise, wish me luck, and hopefully next year I'm spending my winter down in Claremont, Florida, which I like that area. If you ever get on YouTube, look up 55 Plus. They have their own channel, and they're in Claremont, but they tour all over Florida, and they show you all the places to retire. And I don't know, I'm addicted to their shows. 55 Plus, can't remember his name. It's his mom and wife, or no, mom and son team, and pretty cool. Anyways, puts a smile on my face. Just seeing the palm trees and the sun on TV is enough sometimes, you know. So, alrighty. Well, if you have any questions, leave them down in the comments below, and don't forget to subscribe, and I'll try to update more as things come available. I have another Mayo blood work being sent out the end of this month, and going to see the doctor the first week of February, and looks like I may be in remission right now, so that's what we're hoping to see in the blood work. Thanks again. Signing off.